Hi everyone. So my name is Ruth Pape. I'm from Papua New Guinea, and I'm actually attending ESMED in Darwin to present a part of my research, PhD research in mammography. So my background is diagnostic radiography, but I'm specializing in mammography, and my research is looking at the impact of the thorax and on mammographic image quality. So basically looking at the positioning of the mammography using the medial lateral oblique as well as the CC, craniocaudal view, and how it impacts the different positioning technique as well as the body habitus.
And can you tell me in lay terms how that will affect people's experience of screening?
Yes, so basically when we do mammography, our aim is to make sure that we get all the breast tissue as possible onto the image, so that when we don't miss out any breast tissue, meaning that we don't miss breast cancer. And so the aim of my research is to understand how the radiographers, their experience in clinical practice, how they position the mammography equipment when they do those two basic views, and how the body habitus or the shape or the size of the woman affects our positioning technique, especially the radiographers, because women come with different body shapes and sizes, and not one angle of the medial lateral oblique is not perfect. They use different angle and different techniques. So that's where my research is more interested in understanding how the radiographers do those positioning technique to make sure they include all of the breast tissue as possible onto the image, so that there is less missing of tissue, therefore less breast cancer not being picked up early.
And what led you to that? Is it just a natural extension? Is it what leads you to look at that research?
Yeah, thank you. So going back before in Papua New Guinea, I did a couple of radiography work in a private hospital as well as the public hospital. And from my experience with the private setting, I did some mammography examinations, the mammography screening for the women of Papua New Guinea. And I found out that most of the women who came for screening in mammography had advanced cancer, which I didn't understand at the time. And so I would then refer those women to the doctors for further study, and that study can be an ultrasound or they can go for surgery depending on the type of pathology or the lump they had. And so some of those women had passed on. Those who can be able to afford, they come overseas for treatment. And it was kind of a challenging situation where the country did not have a breast screen setup as in Australia or other developed countries. And that kind of triggered my interest to do more research in mammography and to do something, post my PhD, to do something for the women of PNG, in the sense that mammography can be accessed in mostly the rural areas of the country. So that is what triggered me to do more research in this area.
And are things still quite lacking in PNG?
Yep, there is a big. It's still lacking where we still don't have a breast screen program, but we do. However, we do have mammography equipment in hospitals in the city, in the private or the public, and it can be one or two machines in the hospital where majority of the women go and get that diagnosis screening done. However, it's not applicable in the rural areas of the country, so that's a big challenge to get the mammography services into the rural areas of the country, and that's where my interest is.
what does Australia need to think about in terms of these issues for the Pacific?
Yeah, good question. So we have a situation where at the University of Papua New Guinea, where I taught before coming here, we have a bachelor's degree program, and we teach radiography students for 3 years. So they do a first year at the main campus Science Foundation, and then they do the next 3 years at the School of Medicine where I used to teach, and currently they're doing that. So most of our graduates, they graduate and then they go out to serve the country, whether it be rural or urban. Well, we have a dilemma where we still don't have enough radiographers going to mostly the rural areas, and there can be different factors why they don't go out there. So, for example, maybe there's no equipment there for the radiographers to go and practice, or challenges. For example, maybe geographical challenges, logistics. There are different reasons why radiographers do not go out into the rural areas to practice, and you would find that most of them are in the cities or in the main centers where there is equipment for them to practice. And so we have an imbalance of ratio of population of number of people versus the number of radiographers. There is a very big imbalance there. So for example, maybe 27,000 people can be saved by only one radiographer, which is it's a big challenge. And therefore the school is, with the assistance from the people from the public hospital, radiographers especially, are trying to collaborate and with the health department to come up with an assistant program that can be able to train radiographers on the ground, and it can be in a form of certificate training, so that they are already with the people in the rural areas, and they can be trained as assistant, get the certificate, and then serve the community where they live.
And is there a role that Australia or that the Australian medical radiation sciences should be playing with that? Would you like to see them step up?
Yeah, it would be great if Australia and Papua New Guinea have a very good relationship. It goes back beyond pre-independence and during World War II. There is a strong connection there, and even today Australia has played a big part in supporting some of the major developments in the country. So I would really think if would support the idea of Australia continuing to engage, especially with the funding for the health sector, if they can also focus on this area for training purpose, train the staff who are actually on the ground to train those assistant radiographers, provide teaching materials, for example, logistics support, for the current staff who are actually providing the training at the School of Medicine. If there needs to be some form of support for them to go into those rural areas on a kind of like a part-time or locum basis, where they go for a week or so, they take the program, teach the assistants, and then they come back to the uni and then they coordinate from there. So just making sure that the assistants are trained well. So yes, support in terms of funding for the current staff, because we have this limited staff as well, so that's another issue. Material as well, and any other specific areas they would like to support, they can liaise with the staff at the School of Medicine and Health Science, as well as the National Department of Health, as well as Port Moresby General Hospital. So there has to be collaboration, and funding has to be used for that purpose.
Yes.
Yeah.
And is there anything in particular you're looking forward to at the conference or wanting to get out of being here?
Yeah, good question. I'd like to have more networks, because I believe in the power of networking. I'm interested also to attend lectures on radiography or medical imaging, but mostly what are the new techniques that are now currently in the digital era that we are in, so to maximize the diagnosis of patient, that is really my interest, and also the education part of it. To educate the clinical people, especially radiographers who are currently working on the ground. So there has to be this connection between theory, those of us who are at the university level, whatever we are teaching must be made known to the clinical people on the ground. And the clinical people, they're really good with their work too, so they should be then also sharing that knowledge with us. So yeah, I'd like to see this collaboration continue and actively, engaging with, yes, the university level as well as those who are actually on the ground. But also, like I said earlier on, I'm really interested in having a good network, developing good network with people from the industry as well as education or clinical, so that one network, it will make a lot of difference. So having that network is very important, because that one person can influence whatever you're trying to achieve. And I believe in the power of collaboration and networking. That's why I'm here.
Fantastic. Now, Ruth, is there anything else you'd like to say before I let you go off and start to dance?
Well, let me think. What I'd like to say is, I believe in the power of education, and I would like to, encourage, especially girls and females, to be educated. But those who are disadvantaged, if they can have the support of their family or a community or organization to support the girls, I believe in the power of woman empowerment, because educating one female or a girl can educate the whole family and village, and can do greater things for the community. So that's my passion, and I believe in that. So I would love to encourage, especially women and girls, to be educated, and those who are supporting them to please support the girls, to be educated. But also I'd love to see breast cancer being reduced, the global incidence of breast cancer, because that is my passion and my interest, why I'm doing this research, because millions of lives have been lost, and I've also lost close friends who are part of me as well, back in PNG and also in here. So that's my passion, to see that mammography services reach most of the developing countries in the world, those who don't have access at all. I would love to see that.
And was that personal experience of cancer, breast cancer, is that what led you into imaging?
To do medical imaging, it wasn't breast cancer when I did radiography. It was just my passion I had this passion of loving people, especially older people. So back in my village growing up, I would love to sit around old people or help them in anything I can. And they were so dear to my heart. And for example, I would bring them food or give them some few dollars, like kina, PNG kina, or just do whatever I can to help the older people. And that was my passion, and that led me to the uni. And then I wanted to do medicine, but because my GPA at that time, I couldn't make that, reach the GPA, so I didn't do medicine. But I thought, no, because I have this passion for people, especially older people, I was interested to work in a hospital. And that led me to do medical imaging. And to this day, I have no regret. I really love it. But when doing medical imaging, I did general radiography work, until I worked at the private hospital where I was exposed to mammography, and that's when those women came. It's really broke my heart, and that's where I was so into mammography and just studying hard and just trying to do something for the woman. That really changed my whole perspective to really specialize and focus on mammography and early breast cancer.
Thank you so much for sharing all that with me, Ruth.
My pleasure.
Thank you.
That's all right.